Think you're ready for the NCLEX? Let's find out. In this video, we're diving deep into the next level of NCLEX respiratory questions. More clinical reasoning, more case-based challenges, and the most tested concepts. These aren't just questions. They're your secret weapon to passing on the first try. Stay with us till the end, because every question is packed with expert rationales and proven strategies that will boost your confidence and sharpen your critical thinking. Let's crush this exam together, question by question. Here. Question 21. A nurse is caring for a patient who has just undergone a bronchoscopy. Which of the following assessments is the highest priority immediately post-procedure? A. Monitoring urine output. B. Checking bowel sounds. C. Assessing gag reflex. D. Inspecting fourth site for phlebitis. Correct answer. C. Assessing gag reflex. Rationale. After a bronchoscopy, the patient may have a temporarily suppressed gag reflex due to local anesthetic use. Assessing the gag reflex before giving oral intake prevents aspiration. While other assessments are important, the airway and aspiration risk take priority. Strategy. Use the ABC, airway, breathing, circulation priority framework. Always prioritize airway-related concerns after any procedure involving the respiratory tract. Question 22. The nurse is teaching a client with chronic obstructive pulmonary disease, COPD, about energy conservation. Which statement indicates that further teaching is needed? A. I will sit down while preparing meals. B. I will schedule activities in the morning when I have more energy. C. I will hold my breath while walking to avoid getting tired. D. I will gather all supplies before beginning a task. Correct answer? C. I will hold my breath while walking to avoid getting tired. Rationale. Holding the breath increases CO2 retention and worsens dyspnea in COPD patients. Pursed lip breathing is encouraged instead to prolong exhalation and improve oxygen exchange. The other statements reflect good energy-saving habits. Strategy. Eliminate options that worsen symptoms. In COPD teaching, avoid techniques that reduce oxygen exchange or increase CO2 retention. Question 23. Case scenario. Case. A 67-year-old male with a history of smoking and COPD presents to the ED with increasing shortness of breath, productive cough, and wheezing. Vital signs. Heart rate 102 beats per minute, respiratory rate 28 per minute, blood pressure 140 over 84 millimeters of mercury, oxygen saturation 89% on room air. Which of the following nursing actions are appropriate? Select all that apply. A. Administer short-acting beta agonist via nebulizer. B. Place the patient in a supine position. C. Administer high-flow oxygen via non-rebreather mask at 15 liters per minute. D. Elevate the head of the bed. E. Encourage diaphragmatic breathing techniques. Correct answers: A, D, E. Rationale. Administering a bronchodilator, A, helps relieve bronchospasm. Elevating the HOBD promotes lung expansion. Diaphragmatic breathing, E, helps improve ventilation. A non-rebreather mask at 15 liters per minute, C, is too high for COPD patients and can suppress their respiratory drive. Supine positioning, B, worsens ventilation. Strategy. Focus on interventions that improve oxygenation without suppressing respiratory drive in COPD. Be cautious with high-flow oxygen unless in acute respiratory failure. Question 24. A nurse is caring for a patient with tuberculosis, TB. Which isolation precautions should the nurse implement? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions only. Correct answer: C. Airborne precautions. Rationale. TB is transmitted via airborne particles. Patients should be placed in a negative pressure room, and caregivers should wear N95 respirators. Droplet precautions are for larger particles, e.g. influenza, and contact precautions are for diseases spread by touch. Strategy. No infection control by transmission mode. TB always requires airborne precautions. Question 25. Case. A 58-year-old woman with a history of asthma presents to the ED with wheezing, shortness of breath, and chest tightness. You are preparing to administer a medication. Match each medication with its appropriate purpose. Medications. 1. Albuterol, inhaled, purpose, A, anti-inflammatory. 2. Ipratropium, inhaled, purpose, B, bronchodilator. 3. Prednisone, oral, purpose, C, mucolytic. 4. Montelukast, oral, purpose, D, leukotriene modifier. Correct matches: 1. Albuterol, purpose, B, bronchodilator. 2. Ipratropium, purpose, B, bronchodilator. 3. Prednisone, purpose, A, anti-inflammatory. 4. Montelukast, purpose, D, leukotriene modifier. Rationale: albuterol and ipratropium relieve bronchospasm. Prednisone decreases inflammation. Montelukast blocks leukotrienes to reduce asthma symptoms long-term. Strategy: know drug classes and purposes. This format tests your ability to apply pharmacological knowledge quickly and accurately. Question 26. Case scenario: a 66-year-old male patient with a history of COPD presents with increased dyspnea, productive cough with green sputum, and low-grade fever. Question: what is the nurse's priority action when assessing this patient? A. Administer prescribed antipyretics. B. Notify the healthcare provider immediately. C. Obtain a sputum culture before starting antibiotics. D. Place the patient in a supine position to rest. Correct answer: C. Obtain a sputum culture before starting antibiotics. Rationale: the priority in this case is to obtain a sputum culture before initiating antibiotic therapy to ensure the correct organism is targeted. Administering antibiotics first may compromise the accuracy of culture results. Although notifying the provider and administering antipyretics are important, they follow after specimen collection. Supine positioning is not ideal for patients with dyspnea. Strategy: use the nursing process. Assessment before intervention. Prioritize assessment actions like cultures before implementing treatments unless the patient is unstable. Question 27. Question 23. A client with a pneumothorax has a chest tube inserted. Which findings should the nurse report to the provider? A. Continuous bubbling in the suction control chamber. B. Gentle fluctuation, tidling in the water seal chamber. C. Absence of drainage for 2 hours post-insertion. D. Tracheal deviation to the unaffected side. Correct answer: D. Tracheal deviation to the unaffected side. Rationale: tracheal deviation indicates a potential tension pneumothorax, which is life-threatening. It signifies increasing pressure in the chest that may compromise cardiac output. Gentle tidling is expected. Continuous bubbling in the suction chamber is normal. Some initial absence of drainage is not unusual immediately post-insertion. Strategy: recognize signs of complications. Life-threatening symptoms like tracheal deviation must be escalated quickly. Question 28, multiple response. Case scenario: a 50-year-old female with asthma is experiencing an acute exacerbation. She is wheezing, using accessory muscles, and unable to speak in full sentences. Question: which of the following interventions should the nurse anticipate? Select all that apply. A. Administer a short-acting beta agonist. B. Encourage slow, deep breaths with pursed lips. C. Position the patient supine for maximum expansion. D. Administer 4 corticosteroids. E. Initiate rapid sequence intubation immediately. Correct answers: A, B, D. Rationale: short-acting beta agonists, e.g. albuterol, are first line. The 4th corticosteroids help reduce inflammation. Pursed lip breathing slows expiration and improves ventilation. Supine positioning impairs lung expansion. High Fowler's is preferred. Intubation is reserved for worsening respiratory failure and not the first step. Strategy: apply ABC priorities and no asthma protocols. Recognize early versus late interventions and non-invasive support. Question 29. Close, drop down. Case scenario. A nurse is caring for a patient receiving oxygen via nasal cannula at 2 liters per minute due to pneumonia. Question. Complete the sentence by selecting the most appropriate option. To reduce the risk of oxygen toxicity and maintain effective therapy, the nurse should A. Instruct the client to use incentive spirometry every hour. B. Increase the oxygen to 6 liters per minute without notifying the provider. C. Encourage ambulation only after stopping oxygen therapy. D. Replace nasal cannula with a non-rebreather mask routinely. Correct answer. A. Instruct the client to use incentive spirometry every hour. Rationale. Incentive spirometry encourages lung expansion, prevents atelectasis, and improves oxygenation. Increasing oxygen flow or changing devices requires provider input and may worsen hypercapnia in COPD patients. Oxygen should not be removed for ambulation. Strategy. Choose evidence-based interventions for respiratory improvement, especially non-invasive measures. Question 30. Matrix with options case scenario. Recap. A 75-year-old client with heart failure and chronic kidney disease is ordered IV furosemide. The nurse must evaluate the appropriateness of the following actions. Nursing action options. 1. Monitor serum potassium before administration. A. Appropriate. 2. Administer furosemide quickly IV push over 10 seconds. B. Inappropriate. 3. Weigh the patient before and after diuretic administration. C. Appropriate. 4. Hold medication if urine output is less than 30 milliliters per hour. D. Requires clarification. Answer. 1. A. Appropriate. 2 arrow. B. Inappropriate. 3 arrow C. Appropriate. 4 to D. Requires clarification. Rationale. Furosemide can cause hypokalemia, so potassium must be monitored. It should be given slowly, over 1 to 2 minutes, or risk ototoxicity. Daily weights assess fluid status. Urine output is important, but furosemide may stimulate diuresis, so holding it may delay necessary treatment. Clarify with the provider. Question 31. Case-based extended multiple response. Case scenario. A 32-year-old woman presents to the emergency department with chest pain, tachypnea, and hemoptysis. She just returned from a 12-hour flight. Question. Which findings support the suspected diagnosis of pulmonary embolism? Select all that apply. A. Respiratory alkalosis on ABG. B. Sudden onset dyspnea, cardiac bradycardia and hypotension. D. D-dimer level elevated. E. Chest pain that worsens with inspiration. Correct answers: A, B, D, E. Rationale. PE presents with sudden dyspnea, pleuritic chest pain, and tachypnea. ABGs may show respiratory alkalosis from hyperventilation. D-dimer elevation suggests clot formation. Bradycardia is not typical. Tachycardia is more common. Strategy. Link clinical signs to pathophysiology. Think about Virchow's triad and PE features, VQ mismatch, clot dislodgement, and hypoxemia. Question 32. Case scenario with drag and drop. Case scenario. A 68-year-old male with COPD is being discharged. The nurse is teaching the client about oxygen therapy and inhaler use. Question. Place the following steps in the correct order for teaching the patient how to use a metered dose inhaler, MDI, with a spacer. 1. Shake the inhaler well. 2. Attach inhaler to spacer. 3. Exhale fully. 4. Press inhaler once and inhale slowly through spacer. 5th. Hold breath for 10 seconds. 6. Wait 1 to 2 minutes before second puff if needed. Correct order: 1, 2, 3, 4, 5, 6. Rationale. This sequence ensures proper medication delivery to the lungs. Inhalation should be slow and deep. Spacers improve deposition of medication in the lungs rather than the oropharynx. Strategy. Use step-by-step logic in teaching. Emphasize technique to maximize medication efficacy. Question 33. Highlight the correct phrase. Case scenario. A nurse is assessing a patient receiving a high-flow nasal cannula. The client has a respiratory rate of 32, uses accessory muscles, and appears anxious. Question: highlight the most appropriate nursing action. A. Increase oxygen to 100% and monitor the patient for 2 hours. B. Notify the provider immediately for possible non-invasive ventilation. C. Encourage deep breathing and slow respirations for 15 minutes. D. Decrease oxygen flow to prevent oxygen toxicity. Correct answer: B. Notify the provider immediately for possible non-invasive ventilation. Rationale: high-flow nasal cannula may not be enough in this state of respiratory distress. Early escalation to non-invasive support, e.g. BiPAP, may prevent intubation. Strategy: watch for signs of impending respiratory failure and escalate support as needed. Question 34. Case scenario. A nurse is caring for a patient with pleural effusion who is scheduled for a thoracentesis. The client is anxious and has questions. Question: what is the nurse's best response? A. This is a minor procedure and you'll be fine afterward. B. Thoracentesis will remove the fluid so you can breathe easier. C. This procedure will fix your lung problem permanently. D. You can ask the doctor your questions later before the procedure. Correct answer: B. Thoracentesis will remove the fluid so you can breathe easier. Rationale: this answer is accurate, informative, and reassuring without dismissing the patient's concerns. Telling the patient you'll be fine minimizes their fear. Saying it will fix the lung permanently is inaccurate. Deferring to the provider shuts down the patient's immediate need for comfort. Strategy: use therapeutic communication and provide accurate, reassuring information. Question 35. A nurse is preparing to perform nasopharyngeal suctioning on a client. Which step should the nurse take first? A. Set suction pressure to 120 to 150 millimeters of mercury. B. Measure and insert the catheter without applying suction. C. Don sterile gloves and protective equipment. D. Instruct the client to cough forcefully before the procedure. Correct answer: C. Don sterile gloves and protective equipment. Rationale: the first step is to ensure infection control and personal protection. Suctioning is a sterile procedure that requires PPE to prevent contamination and protect both the client and the nurse. Measuring and inserting the catheter, adjusting pressure, and instructing the client all come afterward. Test-taking strategy. When multiple steps are listed, identify the first action by thinking about infection control and preparation. Use Maslow's hierarchy and safety principles to choose what must be done first. Question 36. A client with chronic obstructive pulmonary disease, COPD, is prescribed tiotropium, Spiriva, via a HandiHaler. Which instruction should the nurse prioritize when teaching the client how to use this medication? A. Swallow the capsule whole with a full glass of water. B. Use the inhaler only when you feel short of breath. C. Place the capsule in the inhaler chamber and inhale the powder deeply. D. Rinse your mouth after each use to prevent oral thrush. Correct answer: C. Place the capsule in the inhaler chamber and inhale the powder deeply. Rationale: tiotropium is a long-acting anticholinergic bronchodilator administered via a HandiHaler, which is a dry powder inhaler. The capsule must be inserted into the device, punctured, and the powder inhaled. Swallowing the capsule, option A, is incorrect and ineffective. It is not used on an as-needed basis, option B. While mouth rinsing is essential with inhaled corticosteroids, tiotropium does not carry a high risk of oral thrush, option D. Strategy: focus on medication administration route and device type. HandiHaler equals dry powder capsule for inhalation, not oral use. Educating clients on proper device use improves compliance and medication efficacy. Question 37. The nurse is caring for a client experiencing a severe asthma exacerbation. Which finding requires the most immediate intervention? A. Use of accessory muscles. Bronchial loud wheezing throughout lung fields. C. Respiratory rate of 34 breaths per minute. D. Silent chest with decreased breath sounds. Correct answer: D. Silent chest with decreased breath sounds. Rationale: a silent chest in a client with asthma suggests severe bronchoconstriction and impending respiratory failure. This is a medical emergency. Wheezing, though alarming, indicates some airflow. Option B. Use of accessory muscles, option A, and tachypnea, option C, are signs of distress, but not as immediately life-threatening as the absence of air movement. Strategy: always prioritize findings that indicate lack of ventilation or impending respiratory arrest. In asthma, worsening symptoms followed by decreased breath sounds is a red flag. Question 38. A client has a chest tube placed for a pneumothorax. Which action by the nurse requires immediate intervention? A. Noting continuous bubbling in the suction control chamber. B. Securing all connections with tape. C. Clamping the chest tube to check for an air leak. D. Placing the collection system below the chest level. Correct answer: C. Clamping the chest tube to check for an air leak. Rationale: clamping a chest tube is contraindicated during routine care due to the risk of developing a tension pneumothorax. This action should only be performed briefly by a provider or with specific orders. Continuous bubbling in the suction chamber, option A, is normal. Taping connections, option B, prevents air entry. Keeping the system below chest level, option D, promotes drainage. Strategy: avoid actions that can trap air in the pleural space. Chest tube care requires careful technique to avoid complications like tension pneumothorax. Question 39. A client with acute respiratory distress syndrome, ARDS, is intubated and placed on mechanical ventilation. The nurse notes that the high-pressure alarm is sounding. Which of the following could be the cause? A. Disconnected ventilator tubing. B. Secretions in the endotracheal tube. C. The client has self-extubated. D. The client is oversedated. Correct answer: B. Secretions in the endotracheal tube. Rationale: high-pressure alarms indicate resistance in the system, often due to secretions, biting the tube, or kinks. Disconnection, option A, would trigger a low-pressure alarm. Self-extubation, option C, would result in loss of airway and low pressure. Oversedation, option D, may affect respiratory rate, but not cause high pressure. Strategy: memorize alarm types. High pressure equals blockage or resistance. Low pressure equals disconnection or leak. Prioritize suctioning for high pressure alarms. Question 40. Which of the following lab values in a client with respiratory distress indicates the need for immediate medical intervention? A. pH 7.36. B. PaCO2 55 millimeters of mercury. C. HCO3 24 milliequivalents per liter. D. SaO2 96%. Correct answer: B. PaCO2 55 millimeters of mercury. Rationale: a PaCO2 of 55 millimeters of mercury is within the normal range. 55 millimeters of mercury is above the normal range, 35 to 45 millimeters of mercury, indicating hypercapnia and potential respiratory acidosis. It suggests hypoventilation, which can depress the central nervous system and lead to CO2 narcosis if untreated. The pH, bicarb, and O2, SAT, are all within normal limits in this scenario. Strategy: no ABG normals, pH 7.35 to 7.45, PaCO2 35 to 45 millimeters of mercury, HCO3 22 to 26 milliequivalents per liter, PaO2 80 to 100 millimeters. You made it to the end. Well done. Every question you answered today brings you one step closer to crushing the NCLEX. If you found value in this video, don't forget to like, subscribe, and hit the bell so you never miss a high-yield review. And remember, reviewing with understanding is what separates guesswork from confidence. Drop a comment below with the topic you want next, or tell us what tripped you up. We'll tackle it together. You've got this. I'm cheering for you every step of the way.